Our dental professional and our transplant physician are awaiting their patient Eileen Old to have a consultation prior to her first dental treatment. She is a 50-year-old African American female. She is a non-smoker, weighs 132 pounds, and is 5 foot 7 inches tall. She works part-time as a paralegal in the Community Legal Service Office, which provides assistance to individuals who are poor, elderly, minorities, and middle-income families. Our client has chronic renal failure that has progressed to end-stage renal disease and began dialysis 9 months ago. She is receiving hemodialysis at a healthcare facility Monday, Wednesday, and Friday afternoons each week. She is currently undergoing tests to determine if she is a candidate for a kidney transplant. Our client is presenting today to restore her oral health to get on the waiting list for a kidney transplant. Her chief complaint is that she wants a kidney transplant and was told that her oral health must be improved to qualify for a place on the wait list for a donated organ. Her physician has prescribed an antidepressant to help with her depression due to the overwhelming costs of her disease. Our client has dietary phosphate and salt restrictions and chews ice to manage her restricted oral fluid intake. Our client was hospitalized within the last 5 years to have a surgical transplant of arteriovenous shunt in her right forearm for dialysis. Eileen's vitals were 154/102, which puts her in stage 2 hypertension. Her pulse was 74 beats per minute, which is within normal limits, and her respirations were 14 respirations per minute, which is also within normal limits.
Hello, Eileen.
Hi, Dr. Garcia. How are you?
I'm good. How are you?
I'm good.
Have a seat.
Thank you.
Hi, Eileen. So after conducting your oral health screening from the last time that we met, I've concluded that your oral health is in poor condition and we need to work together to improve it in order for you to qualify for the donation or to be put on the waiting list for the donation of the kidney.
Oh, I see.
Today with me I have Mrs. Chin, the registered dental hygienist, who's going to be taking over your treatment.
Okay.
Hi, Mrs. Old. And she said, my name's Danielle Chin, and I'm the dental hygienist, and we'll be working together to improve your oral health because I know that you really want to get put on that
That's very
transplant list,
for me
right?
now. Yes.
Yes. All right, so first, I'd like to review your medical history. You're currently diagnosed with end-stage renal, and you're currently on hemodialysis 3 times a week
Yes, I am.
for the past 9 months.
Yes,
Yep.
that's correct.
Okay. And I also see that you also have the following conditions. You have renal osteodystrophy,
Mm-hmm.
secondary hyperparathyroidism, hypertension, and anemia.
Yes.
Okay. And for your medications, I see that you're taking Vasotec, Cozar, and Lasix for hypertension.
Yes, that's correct.
Yep. Well, I want to let you know that the Cozar and the Vasotec do have a severe interaction, and one can increase the toxicity of the other,
Oh, my goodness.
and it's possibly life-threatening. So if you should probably have that checked out with your physician and see if there's a possible alternative to
Oh,
that medication.
Sure.
Okay. And also say you're taking Proprit for the anemia,
Yes.
Prozac for depression,
Yes.
Calcitriol to increase your blood calcium,
Mm-hmm.
Calcitrue, a calcium-containing phosphate binder,
That's correct.
and the heparin during your dialysis.
Yes.
Is there any other medications you're taking that I haven't mentioned?
No, I think that's all.
Okay. Well, I also want to let you know that these meds also have oral manifestations. They can cause dry mouth and sometimes a bitter metallic taste.
Oh, yes. At night, my mouth is so dry, I have to eat ice because I can't drink too much water.
And some of them also cause hypotension and vertigo. So, throughout the appointments, I don't want you to get up too fast from the chair. We want you to raise slowly and take your time getting up from the chair.
Okay, I'll make sure I do that.
Okay. Can you tell me when your last dental visit was?
Oh, it was a while ago. It was, I think, more than 5 years.
More than 5 years?
Mhm.
Okay. And how would you describe your home care right now?
I do brush once daily. Oh, and I found this amazing toothpaste that's supposed to take all the buildup off of my teeth.
Okay.
It's supposed to make them nice and shiny.
Is it working?
I don't know. You tell me. You tell me.
And is there anything else that you want to tell me?
I'm not flossing.
You don't floss?
Yes. Just wanted to let you know.
Okay.
And I'm very scared of ingesting fluoride.
Fluoride?
Yes, that scares the bejesus out of me.
Okay.
Mhm.
No problem. Well, we're gonna, work together and
Okay.
we're gonna try and improve your oral health, okay?
Very good.
So first we're going to do some assessments. We're gonna take some x-rays, some intraoral images, and get started, okay?
All right, sounds good. I'm
All right,
excited.
let's go.